let's be real. Preparing for the NCLEX feels like trying to memorize an entire library. But what if you could just focus on the stuff that shows up again and again? Well, that's exactly what we're going to do. This is your high-speed review of the absolute must-know facts. Let's get right into it. I want you to think of this as building an emergency brake for your brain. You know that feeling during the test? The pressure's on, your mind starts racing, and panic starts to creep in. That's when you need a system you can trust to just pull the brake, stop the chaos, and lock in on the right answer. So how are we going to build this thing? We're going to do it piece by piece, focusing on 5 critical areas you absolutely have to know to pass: labs, patient priorities, isolation precautions, pharmacology, and then a final rapid-fire brain dump to tie it all together. First up, your dashboard. Just like in your car, you need to be able to glance down and know immediately if a warning light is on. For us as nurses, those warning lights are our critical lab values. You've got to know them cold. Okay, the most important column on this chart, the one you need to burn into your brain, is the one labeled critical. This is where you score points on the exam and, more importantly, save lives in reality. A potassium level below 2.5, that's not just a number, that's a huge cardiac risk. Hemoglobin below 7.0, that patient might need an immediate blood transfusion. And an INR over 4.0, that signals a massive, massive bleeding risk. These are the red flashing lights you can never, ever ignore. All right, next up, we need a GPS. The NCLEX just loves to give you these questions where it feels like 4 different patients are crashing at the same time. These priority frameworks, they're your guide. They tell you who to see first, no matter how chaotic it seems. And here's the deal. Airway, breathing, and circulation, your ABCs, they almost always win. It's the gold standard for a reason. If an exam question gives you a choice between a patient who's anxious and a patient who's short of breath, you go to the breathing problem every single time. And Maslow's hierarchy totally backs this up. Those basic physiological needs are the foundation of everything. And this brings us to the core of all nursing logic. Add P. Here's a huge tip for the NCLEX. If a question asks what you should do first, you need to scan those options for the assessment choice. You always assess before you intervene. You look, you listen, you gather your data before you act. Now for our safety features. I can pretty much guarantee you're going to see isolation precautions on the NCLEX, especially in those dreaded select all that apply questions. So knowing these next few mnemonics, it's completely non-negotiable. Okay, for airborne, just remember the simple phrase, my chicken has TB. That's going to cover measles, chickenpox, herpes zoster, which is shingles, and of course, tuberculosis. For any of these patients, you need the whole setup: a private room, negative pressure airflow, and you have to be wearing a fitted N95 mask. Next up, droplet precautions. The mnemonic here is Spider-Man. This one covers a huge list, right? Sepsis, pneumonia, influenza, diphtheria, epiglottitis, rubella, mumps. The list goes on. The key here is that these droplets don't travel very far, so a surgical mask and keeping about a 3-foot distance are your go-to tools. And finally, contact precautions, with the mnemonic MRSWEE. This is for anything you can catch through touch, like MRSA, C. diff, or nasty wound infections. The rule is super simple. If you're going to touch the patient or anything in their environment, you need a gown and gloves. Oh, and don't forget, dedicated equipment for that room is a must to stop the spread. Okay, time to open up our toolkit. I know, pharmacology can feel like this massive, overwhelming mountain of information. But listen, the NCLEX doesn't expect you to be a walking encyclopedia. What it does expect is for you to recognize patterns and to know your critical, life-saving rescue meds. This table right here, this is your secret weapon. Seriously, you might not recognize the full name lisinopril, but if you see that pril on the end, you know it's an ACE inhibitor for blood pressure. Same goes for Olol, that's a beta blocker, or statin, that's for cholesterol. Recognizing these suffixes is like having a cheat code that can unlock a question even when you don't know the specific drug. And these are the pairings you just have to memorize. There's no way around it. These are your absolute lifesavers. If your patient is bleeding out from warfarin, you gotta know the antidote is vitamin K. For an opioid overdose, you're reaching for naloxone. Knowing these 5 pairs is absolutely critical for the test and for your practice. All right, let's do one final systems check. This is the rapid-fire brain dump section. These are the quick recall facts that can save you precious points on multiple questions all across the exam. You ready? Let's go. Isotonic fluids, like your normal saline. The I in isotonic is your clue. It stays where I put it, right inside the vein. This is your go-to for simple hydration. Hypotonic fluids. The O in hypo reminds you that the fluid goes out of the vessel and into the thirsty cells. Think cellular dehydration. And hypertonic fluids. The E in hyper should make you think enters the vessel. It literally pulls fluid out of swollen cells and back into the vein. This is huge for things like reducing brain swelling. Right-sided heart failure. Just think, R is for the rest of the body. The blood is backing up systemically, so you'll see swelling in the legs, a bloated belly, and that classic jugular vein distension or JVD. And left-sided heart failure. L is for lungs. The blood is backing up into the lungs, and that's a respiratory crisis. You're going to hear crackles, see pulmonary edema, and the patient will be struggling to breathe. And there it is. Your NCLEX emergency brake is officially built. You've got your dashboard for labs, your GPS for priorities, your safety features for precautions, and a whole toolkit for pharmacology. Remember, the goal isn't to know everything. It's to have a reliable system you can count on when the pressure hits. Now go in there with confidence. You've totally got this.